Hello and welcome to this week's edition of Health Talk. I'm Zama Buthelezi, and today we focus on cancer. National Cancer Survivors Day is an annual treasured celebration of life that is held in hundreds of communities nationwide and around the world on the first Sunday in June. It's a celebration for those who have survived, an inspiration for those recently diagnosed, a gathering of support for families, and an outreach to the community. So what's coming up on the program, producer Wandile Mufukeng spoke to a woman that survived breast cancer and a man that survived prostate cancer. They share their stories with us. We speak to a health specialist from the Cancer Association of South Africa about cancer and hope. We then speak to an oncologist to understand more about cancer. We also speak to the founder of the first patient-led cancer registry, who is also a survivor of cancer. But first, let's go through the latest COVID-19 numbers. COVID-19 levels of new infections and active cases in most provinces in the country continue to increase, with national statistics of COVID infections topping the 3,000 and the 5,000 mark, as some provinces are already on the third wave of this pandemic. This happens when coronavirus variants first detected and are dominant in India and the United Kingdom landed in South Africa a few weeks ago. Also, the second wave of the country's vaccine rollout continues for South Africans over 60, along with healthcare workers. That's a bit slow. 4 provinces out of 9 have entered the third wave of this pandemic, these being Gauteng, Free State, Northwest, and the Western Cape. But this doesn't mean that the others are not at risk, looking at the increasing numbers, and to avoid these provinces these provinces should adhere to safe protocols. On the other news, Health Minister Zweli Mkhize has been placed on special leave by President Cyril Ramaphosa and will present himself to the ANC's Integrity Commission in relation to the 150 million Digital Vibes contract. Tourism Minister Mamuluko Kubai-Ngubane will be acting health minister, the presidency announced. For now, though, let's take a look at the national COVID-19 statistics. Over 12 million tests have been processed in South Africa. Over 1.7 million positive cases have been recorded. Over 1.5 million people have recovered, but sadly, more than 57,000 people have died from COVID-related illnesses, and we're sending our sincere condolences to their families. New infections continue to increase in some provinces with big metros. And as Gauteng leads with the infections and the province having entered the third wave of this pandemic, it is now more than ever critical for Gauteng residents to take extra care and continue to take precautions. And most of all, avoid mass gatherings, which have been deemed as super spreaders for the virus. But for now, though, let's take a look at the infection numbers recorded. In the last 24 hours, over 5,000 positive cases have been recorded in Gauteng, over 900 positive cases have been recorded in the Western Cape, over 400 positive cases have been recorded in KwaZulu-Natal, over 200 positive cases have been recorded in the Eastern Cape. The 3 provinces, being the Northern Cape, Northwest, and Free State provinces, continue to record the high numbers of new infections, and according to reports, the rise in cases was a result of cluster outbreaks. These provinces, according to reports, have increased testing and contact tracing to contain the situation and limit further spread, and are now on the third wave of the COVID pandemic. But for now, though, let's take a look at the infection numbers recorded. In the last 24 hours, over 500 positive cases have been recorded in the Free State, close to 600 positive cases have been recorded in the Northwest, over 300 positive cases have been recorded in the Northern Cape, over 300 positive cases have been recorded in Mpumalanga, close to 200 positive cases have been recorded in Limpopo. So, to prevent the spread of the virus and the third wave across the country, we are all still urged not to become complacent as the virus is still around. So let's continue to take precautionary measures, and these include regularly washing our hands with soap and water as this virus stays active on surfaces that we touch. Sanitize using sanitizers containing 70% alcohol content. We must all continue to wear a cloth mask that covers both our nose and mouth in public. We must all continue to practice social distancing and ensure proper ventilation indoors. So if you believe there is a chance you may be infected with the virus, call ahead to seek medical help from your healthcare provider or use the public hotline. It's a free number, 0800 029 999, and alert them to your symptoms. Remember to protect yourself, to protect others. So for now, let's take a short break. We'll come back just now. Anthea Lewis was diagnosed at the age of 38 with breast cancer. At that stage, she was one of 3 who were battling cancer in her family. Anthea is now about celebrating life. She lives each day to the fullest and leaves room for no regrets. She shares a story of hope with producer Wandile Mufugeng and inspires those around her with the words, "I have cancer, cancer doesn't have me." Let's take a listen.
Anthea, thank you so much for giving us your time, and welcome to Health Talk on SABC News.
Good afternoon. It's an absolute pleasure for me to join you guys.
Could you just kindly talk to us about your journey with cancer? We now know you as a cancer survivor, but could you kindly tell us when were you diagnosed with cancer and what type of cancer was it?
So I am a breast cancer survivor. I was diagnosed towards the end of 2010. It was not an easy diagnosis. At the time of my diagnosis, we were 3 in the family that was diagnosed with breast cancer. I was the youngest out of the lot.
Now that you were diagnosed with breast cancer back in 2010, how difficult or easy was it for you to accept the diagnosis?
Initially, when I was diagnosed, I was journeying with my aunt a year prior to my diagnosis, and I used to go with her to hospital, and many times I would tell the family, I don't think I'm bringing her home today. So in a way, that has prepared me for my journey. But it's definitely not the same. We can be 2 or 3 females diagnosed with breast cancer, but each one's journey is different. Each one's support system is different, as well as each one's treatment plan.
Speaking of treatment plans, could you just kindly elaborate or tell us more as to what form of treatment did you undergo in order to survive cancer?
I had a lumpectomy where they removed the cancerous lump. And then I've also had chemotherapy. And I want to tell you, chemotherapy, it's hectic. It's hectic when that fluid is running through your veins. It's like a coldness that comes over you. It makes you very sick. And I had to hear once asking doctors, and they said, we first have to kill all the healthy cells as well as the unhealthy cells in order to make you better. So it first makes you very sick. But at the end result, it makes you better.
How did cancer generally impact your day-to-day living, or rather impact your life?
It impacts a person on various levels. So for me, it was not just the physical part, it was also the emotional part, going through cancer and you going through the treatment, you're going to hospital and you feel all alone. And then obviously not being able to work, not being able to afford your rent, and then ending up in a shelter. So it is really a disease that can affect the person on all levels.
In your situation, can you say you are on remission or the cancer is undetected? What's the difference there? Take us through your personal experience with it.
So luckily for me, I am in remission where there is no traces of the cancer. So I'm going on with life as per normal, where if someone, if there is still traces of cancer, it just means that they're not in remission and they still needing to go for treatments and things like that. So I'm in remission.
Now, lastly, just your words of encouragement to someone who is battling any type of cancer. What would as a survivor, what would your words of encouragement be to such a person?
If you have heard the words, you have cancer, I want to tell you today that you are a survivor, and with the treatment and with all of our fantastic oncologists that we have, and with a good support system, you can surely beat cancer.
An incredible story there from Anthea Lewis, a breast cancer survivor. Let me welcome my colleague. Good morning, Peter. Did you remember to wash your hands this morning?
Yeah, I was busy washing my hands. That's what it is. How are you doing?
I'm good, thank you.
Gosh, those statistics are not telling a great story, are they?
Not at all. We
goodness.
need not to be complacent. I'm always saying this. Let's continue to take precautionary measures. So after the show, because you've been touching the desk, remember to wash your hands again.
Thank you very much indeed, Zama. Still so much to come on the programme. You're watching Health Talk, and after the break, we speak to Professor Michael Herbst, a health specialist at the Cancer Association of South Africa, otherwise known as CANCER. And we'll be talking all about cancer and hope. Stay with us for that. Welcome back. You're still watching Health Talk. Now, if detected early, prostate cancer has an enormously encouraging 5-year post-diagnosis survival rate. Upwards of 95%, in fact. Unfortunately, this starts to drop to 29% if the disease has spread to distant parts of the body at the time of diagnosis. Now, David is a prostate cancer survivor, and he hopes that by speaking out about the disease, he may induce men to get themselves screened regularly. He shares his story with producer Wandile Mufokeng.
Mr. David Lucas, thank you so much for being on the program. Welcome to Health Talk on SABC News.
Good morning to you, Wandile, and to all your listeners.
Now, Mr. David, you are a cancer survivor. Before getting to how you survived cancer, maybe could you just briefly tell us when were you diagnosed with cancer and what type of cancer was it?
Right. Wandile, I am a prostate cancer survivor, the type of cancer that mostly affect men, and particularly men over the age of 40. Younger men are normally affected by what is known as testicular cancer. I was diagnosed in 2011, and I must be honest with you, merely by chance.
What form of treatment did you undergo for you to survive cancer?
Wandile, mine, it differs from people, but I'll add on as well. But my situation was after the biopsy and, a diagnosis of cancer, I then went on and did what they call brachytherapy. Now, it's a very simple thing that they do. The doctors put you under anesthetic. They put, I would call it, for the sake of viewers, I would like to just call it little seeds, radioactive seeds implanted in your prostate. And these seeds then releases the radioactivity, and that kills the cells within the prostate.
Now, could you also maybe kindly tell us within your cancer journey, have you ever been on remission? How many times were you in remission?
I'm presently in remission. It has taken some time since 2011 and the beginning of 2019, 2020. With this COVID, we tend to forget dates and things because it's like 2020, that year has just passed and gone away. But yeah, I think it was beginning of 2020 or 2019 that I have been cleared. I still have to go for regular checkups at least once every 6 months.
What lifestyle changes did you have to do to make sure that you do not invite cancer back into your life?
We must be realistic that in many cases we live a life where we can unfortunately invite those things. Argument, smoking. excessive alcohol or alcohol abuse. These are some of the factors that's there. But I do not see the reason why I should become, as the people call the gym junkie. Now suddenly, I live in the gym. Suddenly I can't do anything. I must eat X, Y, and Z food. Technically, I eat basically anything.
Your words of encouragement to someone who is living with a particular type of cancer, what would your words of encouragement be to those who want to give up or take their own lives, seeing that they are not getting rid of cancer? What would your last words of encouragement be?
As a male, you also understand, and most males, we have friends and we talk. Virility and sexuality is always one of the talks that we have, one of the things we discuss. And one of the worrying factor why men are scared to know whether they have cancer, and particularly prostate cancer. Meneer, again, if you are diagnosed early enough, you will not have a problem with sexual function. You will be able to still carry on. You need to ensure that you do that early enough so that that doesn't happen.
Now, the Cancer Association of South Africa, Cancer, recognises the courage displayed by those affected by cancer as they go through diagnosis, treatment, and as well as the side effects and the benefit of support throughout this journey from fellow survivors. Now, they're looking for you to help collect at least 90 stories of hope as part of cancer's 90th anniversary of fighting cancer through research, education and support. And to speak to us a little bit about Cancer Stories of Hope, hashtag Cancer90, we're now joined by Professor Michael Herbst, who's the Head of Health at Cancer. Prof, thanks very much indeed for joining us and welcome to the programme.
Thank you very much.
All right, I love the idea of hashtag Cancer90. Talk to us a little bit more about this. What are you trying to do?
Well, I think it's really important that we get the message across to everybody that cancer, the organization, has been around for 90 years. We're so blessed because we know during the hardships, we've seen that fellow NGOs, some of them have had to close their doors, and because of financial implications. And God has been good to this organization. We're still going strong, even in our 90th year, and we want to share this with every citizen within South Africa, because cancer is really on the increase. The latest statistics tell us that there were more than 82,000 people diagnosed in 2017. And I can tell you that the figure for 2021 is going to be far in excess of the 82,000 that we saw for 2017.
All right, so these stories, what do you want them to tell? What are you hoping that they will do?
Well, we trust that people will share with us that cancer is not necessarily a death sentence. There is treatment available for people who have been diagnosed with cancer, and there's excellent treatment available in South Africa. I can tell you that I have a little bit of hesitation at all to say that South Africa has of the best oncologists, those are cancer specialists in the world, and we provide everything that any other country in the world can provide to cancer patients, and especially to cancer survivors. And we want to celebrate each day with every cancer survivor in South Africa.
Within Cancer, your association, what sort of programs are there for survivors of cancer?
Well, if we look at how we define a cancer survivor, and we say that everybody who's been diagnosed with cancer and is still alive is a cancer survivor. And for people like that, we provide support not only for the person who's been diagnosed with cancer, but also their loved ones. Because we must remember that if there is a single individual within the family that has been diagnosed with cancer, the diagnosis affects every member of that family. Because there's always other people who have a loved father, a mother, a brother, a sister, an uncle, an aunt, or whatever other relative, and even a good friend that has been diagnosed with cancer, and we want those people to be around us for as long as we possibly can have them, and provide them with the best quality of life and the comfort and support that they so deserve.
I suppose there's a lot of anxiety when you first get diagnosed, and this carries on throughout treatment. But, you know, maybe people don't say it too much, but post-cancer, there's always also that fear, isn't there, that they carry that, oh my goodness, it might come back.
Yes, I think that is something that is in the back of every cancer survivor's mind. And that is why we provide them with the support that they deserve and information. For instance, go for your continuous screening that you need to go for. Don't stop with screening. Visit your doctor regularly and still continue to practice all the cancer-reducing practices that we have, like do not smoke, avoid alcohol, go for your regular screenings, which I've already mentioned, eat a healthy diet, try and avoid highly processed foods as much as possible, maintain all your vaccinations because those are really crucial, reduce the intake of red meat, stay out of the sun from 10 o'clock in the morning till about 3 o'clock in the afternoon, and then use sunscreen when you go out into the sun to protect your skin. Because we know that there are thousands of people diagnosed of all skin tones in South Africa, diagnosed with skin cancer every year. Maintain a healthy weight, because obesity is one of the problems that assists in increasing inflammation in the body and increases the risk of cancer. And then to be physically active as possible and to avoid risky behavior. And I think that's sort of the crux of the matter that we want to say to cancer survivors so that they can reduce the fear of cancer coming back.
And that list, everything that you mentioned, I mean, that's for everyone really, isn't it? And that's to help prevent.
Absolutely. This is the recipe for reducing the risk of cancer. And especially so for people who have a fear, that we just continue reminding them that these are the things that are available and that we as individuals can have control over.
Yeah, and I suppose there's nothing more powerful than testimonies, and why the stories thing is important, because sometimes people get hope by listening to other people's stories of survival.
Absolutely, you know, this is why one of the services that we provide, and it's really been on a little bit of hold at the moment with COVID-19, are the support groups that we have. But we still have some support groups on WhatsApp groups. And this is so important that people then support each other and that they can share their testimonies, that they can share their stories of hope and their stories of what do I do to assist myself and to keep strong. And one person keeping the other strong is really a wonderful opportunity for everybody to participate in.
What kind of cancers have you seen? I mean, you're saying that there's been an increase. Which ones in particular are you seeing are happening more and more now?
Well, let's look at the latest statistics. That I can tell you for men in South Africa, the top 5 cancers are prostate cancer, colorectal cancer, you know, and this is something that we didn't see a few years ago. It was really one of the rarer cancers. It is now cancer number 2 amongst men. Then lung cancer and non-Hodgkin's lymphoma, and the 5th one is melanoma. For women in South Africa, breast cancer number 1, cervical cancer number 2, then also colorectal cancer is number 3. Then cancer of the uterus and lung cancer. And really, we must also then remember that even though breast cancer is number 1 for all women and cervical cancer number 2, when we look at the population, the African population of South Africa, those two swap positions. And for black women, cervical cancer will be cancer number 1 and breast cancer will be cancer number 2, and the rest stays the same.
All right, and bottom line, lifestyle changes, good weight, good diet, exercise is going to help every single person to meet some of these challenges.
Absolutely. And the final message, anything that's different in your body today than it was last week or last month or last year, have it seen to, have it investigated, because an early diagnosis means early treatment, and it provides a better future for everybody.
Professor Herbst, always great talking to you, and happy 90th to cancer, not you.
Oh, well, you know, I'm not far away from that, but I'll take the message back home, and thank you for you to share with us our 90th birthday. And as I say, mine isn't very far off from now. I'm
Fantastic.
76, so
you're
and
still
God
a baby.
is still going strong.
You're still a baby.
Yes.
Thank you so much, Prof. Take care.
A lovely day to you, to all your viewers and listeners.
All right, that's Professor Michael Herbst, who's the head of health at the Cancer Association of South Africa, talking to us about the importance of all of the lifestyle changes. Cancers are on the increase, and part of that is the way that we live. And so we really need to be mindful of that. Now, after the break, we'll be learning a little bit more about the different kind of cancers with oncologist Dr. Omondi Ogude. Stay with us for that. Welcome back. Now, cancer is the uncontrolled growth of abnormal cells anywhere in the body. There are over 200 types of cancers, although there are many tests to screen and presumptively diagnose cancer that define diagnosis is made by the examination of a biopsy sample of a suspected cancer tissue. Now, in this segment, we want to learn a little bit more about the types of cancer, particularly the common ones, treatment methods, and how to prevent some of these cancers. And we're now joined by Dr. Omondi Ogude, who is an oncologist at Mediclinic in Johannesburg. Thanks so much indeed for joining us, and welcome to the program.
Thank you so much for having me.
All right, just before the break, we were speaking to Professor Herbst from the Cancer Association of South Africa, and he said that it's incredible to see just how cancer is on the increase. Is this something that you're experiencing in your practice? And if so, what do you attribute it to?
I think certainly we're seeing an increased incidence among certain cancers, and I think this is largely lifestyle related. We've seen particular increases in colorectal cancer, which we know is associated with low fiber, high fat diets. We've seen an increase in breast cancer patients. And we're also seeing an increase in cancer patients or cancer in patients who are fairly young. So we're seeing it in early 40s and even patients in their 30s as well.
All right, so modern living is changing our habits. And with that, we're making ourselves more vulnerable to some of these cancers. Do you still get people who, I'm always reminded of Lance Armstrong, who for a year, he had a growth on his testes, and yet he didn't go to the doctor. Is that something that you still see people, they can see something's wrong, but something stops them going to the doctor?
That's correct, yeah. So, I mean, it's the underlying fear and, sort of connotations that go with cancer have, still persist despite increased information around this topic. So there's, and a lot of these things are sometimes culturally related, sometimes related to levels of exposure and education. But yeah, there's still a great sense of fear within the community, and I think there's still a lot that we need to do to inform people and say that there is help, there are things that you can do, and the sooner that you seek help, the better your chances will be.
And I was just about to ask that the key to some of this is getting diagnosed early, because then you have more options in terms of treatment.
Certainly. So, the earlier the stage that the cancer is picked up, the less likely that it has spread. And invariably, the more effective the treatment is. Our treatments tend to be more effective where there's less cancer and where this is picked up earlier and it has not spread. However, in those in patients in whom cancer may have spread, we're we're increasingly becoming much better at this, and there's an increasing number of treatments that we can offer our patients now.
Yeah. So medicine has gotten better over time. So your chances of survival have increased quite a bit as medicine has advanced.
No, substantially. You know, the research in this field is just astronomical and almost difficult to keep up with. We've got innovative drugs such as targeted treatments. We've got immunotherapy, which has made a huge strides. You know, 5-6 years ago, if you had stage 4 melanoma, your prognosis was less than 6 months. You know, but we have newer immunotherapy drugs now, where about 50% of those patients are now cured. So, you know, in a very short space of time, we've made huge strides. You know, still a lot to do, but I think we will get there eventually.
All right, let's talk a little bit about definitions. Again, Professor Herbst said that a cancer survivor for him is someone who's still alive. Medically, what do you consider as someone who's cured?
Yeah, so cures it's a difficult term and I suppose contentious term in patients with cancer. But generally, we tend to consider patients who are disease-free for more than 5 years to be mostly cured. But it is important to specify that all cancers are quite different. Some are more aggressive than others, and one has to differentiate and be clear about what cancer you're speaking about. So some you can be quite clear that after a 5-year period, it's very unlikely that it will recur. But in some patients, they can recur. Whilst in other patients, you know, these cancers never go away, but are treated like chronic conditions and almost like high blood pressure and diabetes. And these patients can live very long, fulfilled lives with good quality of life.
And what's the most important work for you when it comes to people that are in remission and those that are, you know, in the post-cancer treatment phase?
What's important for them?
For you as a doctor in dealing with these patients, yeah.
Yeah, sure. Look, I think one is to obviously observe them closely and continue regular screening. Patients can develop separate cancers. Often patients with cancer might have familial genes that predispose them to cancer. So it's important to continue to screen them for their known cancers and also those that they may be at risk for. So if you've had colorectal cancer, your risk of developing another colon cancer that's separate and unrelated is a lot higher than the so-called normal population. And if you've had a BRCA positive breast cancer, for instance, you'd be at risk of developing ovarian cancer. So patients have to be counseled on these risks and surveilled with these in mind.
How important does counselling become? Because, you know, anxiety and fear is what got people sometimes not to talk to you guys. And then, obviously, going through the process, it's sometimes enormously hard, difficult, painful. And then there's the survival stage. I'm sure that there are psychological aspects that are also quite equally important to walk through.
No, certainly, and this can't be understated. I think you've touched on a very important topic. We often don't pay the attention that we should to mental disease. You know, in Santon Oncology, we make it a point that we have counselors and psychologists involved with our patients throughout their journey, whether they are on treatment, whether they're just about to start, or whether they've completed. You know, there's such things as survivor's guilt as well, which can often play on patients' minds. So at every phase is, besides the, you know, often obvious physical trauma that's often associated with cancer, the mental trauma can be just as devastating, if not more.
All right, so different types of cancers, particularly for men and women. Let's start with your advice for men, based on the most common cancers that you're seeing. And perhaps we've said these before, but there's never any harm in repeating your best advice in terms of changing our lives and getting early diagnosis. But let's start with the lifestyle aspect for men, and then we'll talk about women.
Sure. So certainly for a lifestyle aspect, and I think this goes across the board, is paying attention to one's diet, picking their foods carefully, having a low amount of processed foods as possible, increasing the number of vegetables and fruits. And, a lot of this, I think most people have heard before and don't know about, and just have to apply to their lives. Exercise is incredibly important. For men specifically, I think in terms of surveillance, we worry about prostate cancer and colon cancer, which are probably the most common in these patients, followed closely by lung cancer. So seeing your urologist or seeing your GP, doing a PSA test, particularly those men who are entering their 50s. This can easily be done as a blood test. It's called a prostate-specific antigen or PSA. Those who are in their mid-40s to early 50s should also have a colonoscopy, a screening colonoscopy. And this will largely pick up cancers at an early stage and can be dealt with in a fairly minor way with minor procedures. And they don't necessarily have to see myself as an oncologist eventually.
So a colonoscopy, is that something you do? I mean, for prostate, I go to my doctor on my birthday every year, just as a reminder. And so 2 questions there. One, must I go more often as I get older? Or is once a year generally enough?
I think once a year is sufficient.
Yeah.
I think that's more than sufficient, particularly for prostate. These are generally slow-growing cancers,
Yeah.
and often by the time we've picked them up, they've been brewing for two years or so, for a significant amount of time. So certainly a yearly screening will be sufficient. And the colonoscopy, if it's normal and there's nothing found and you don't have a significant family history, you only need to do this once every 5 years.
All right. Let's talk about women, because their cancers are slightly different, but I guess the lifestyle portion probably the same.
True. So the same applies to them. I think with females, of course, the pap smears, as we know, are quite important. So it's important to see your gynae regularly. Cancer of the cervix is, it's probably a leading cancer at the moment and takes a lot of lives. It's very preventable and is very curable when it's picked up early. So one needs to do that. There's a higher incidence amongst patients with HIV/AIDS, and they need to be screened more frequently, at least once a year, to have their pap smear. And as you know, we have a high proportion of these patients in our country. So there needs to be an awareness about that. Of course, and you start your pap smears at least when you become sexually active is important, or between 25 and 30 years of age. And then breast cancer specifically, we start screening for at age 40, and that's when you should have your first mammogram. And we do this on an annual or to a biannual basis.
All right, let's go through a little bit of the treatment processes of the more common cancers. And whilst we're talking about women, which ones are the top cancers for women, and how do you go about managing them?
Sure. So cancer of the cervix, certainly very common. Breast cancer, very common. Both of those right at the top. Those are followed by colon cancer and lung cancer as well. So, the first part is obviously diagnosing these,
Yeah.
and preferably diagnosing them early. Patients with early stage cancer of the cervix can be treated with surgery. If it's picked up in the pre-malignant phase, so pre-cancerous phase, they can have an office procedure to, for lack of a better term, burn the cancer, and this can prevent it from developing altogether. And of course, in patients with sort of more advanced cancers, you can use chemoradiation and chemotherapy to control these. With breast cancer, similarly, if you pick up early precancerous lesions, these can be cut out and no further treatments needed. And in some patients, they will require bigger operations, like lumpectomies, cutting around the tumor, or a mastectomy if it's particularly big tumor. And of course, chemotherapy and radiation for those who have more advanced or aggressive diseases as well.
All right, so what about men?
With men, prostate cancer, of course, being the most common. If it's picked up fairly early, one can have an option. Some patients who actually, if you're fairly elderly and it's a very low-grade tumor, we can afford just to monitor or treat with some hormonal anti-hormonal therapy to just suppress the testosterone, which is known to make this cancer grow. Whereas in early prostate cancer patients, in younger, fitter patients, we look at either surgery or definitive radiation. And this is an option. There's pros and cons to both. But these are conversations, of course, that you have with your doctors and decide on which treatment would best suit you.
All right. So we have a lot of smokers in South Africa. Lung cancer, is that a tricky one to manage and treat?
Yeah, lung cancer is tricky from a few aspects. I think it is difficult to screen for because, of course, the lungs are inside of the body and not easily accessible. Unlike, a patient, a breast cancer patient, for example, where a lump can be felt. So these patients often present late because the tumors would have grown for a while. There's lots of space in the lung. Often they won't be symptomatic for some time. So they can be quite difficult to pick up. There are international guidelines in terms of screening now, where you can do low-dose CT scans for patients who've had a significant smoking history. So you're looking at about 15 years or more, where you've been smoking at least a pack a day. These patients should probably be having a screening CT maybe once every 5 years or so with a low dose of radiation, just to look for early cancers. It's not wide, it's not sort of readily available, particularly in the state because of the cost. But certainly for patients in private, this may be an option. It's something you can discuss with your doctor.
All right. So perhaps as a final message, as you talk to our viewers, as one who sees people with cancer all the time, what's the best advice you've got for us as viewers and as citizens?
I think one needs to take care of themselves. I think we take our health very much for granted. So focus on your health. Know your history. Know your family history. Sometimes a lot of this is out of our control, unfortunately. We do tend to speak about lifestyle and that kind of stuff a lot. But to a large extent, some patients, this runs in the genes. And you can't choose your parents. You have the genes that you have. But you can put yourself in a position where you can screen yourself regularly for whatever cancer you're at risk for. We've spoken about some of the most common malignancies, and these often account for about 60 to 70% of the cancers that we see. So if you go out to your doctor regularly, get these checked out, you put yourself in a good position to make it less likely that you can develop these or that they're picked up early, and you can do something more definitive about them.
Dr. Ogude, thank you so much indeed for giving us your time and some sage advice. Thank you.
Great. Thanks so much for your time.
All right, that's Dr. Omondi Ogude, who's an oncologist talking to us about, again, it's lifestyle. A lot of it is lifestyle. Get checked out sooner rather than later because it can make such a difference in the process afterwards. Now, after the break, we speak to Belinda Wagner, who's the founder of the first patient-led cancer registry, who herself is a cancer survivor. Stay with us for that. Welcome back. You're still watching Health Talk. Now, when Belinda Wagner was diagnosed with a rare cancer in 2016 called angiosarcoma, she looked for information about cancer and support groups to help her navigate the immense challenges that lay ahead. Well, Belinda decided to launch an NGO, which was required to drive the work that needed to be done. One of her visions was that the NGO, Living with Cancer, would oversee the first ever South African patient-led cancer registry, and this would capture and track the journeys of people living with different types and stages of cancer. She joins us now to tell us a little bit more about this registry. Belinda, thanks very much indeed for joining us, and welcome to the programme.
Thank you.
Yeah, perhaps we can start with your own journey, because every journey, I guess, is a story of hope for others. Tell us about being diagnosed and what your journey was like in the end.
So I was diagnosed, as you said, in 2016, and as every other person that gets diagnosed with a cancer, and then a rare cancer, you go through stages of various emotions, fear, anxiety, and then you make a decision, of what are you going to do? My decision was I'm just going to live. So I took on this journey, and I thought, what could I do about it? And that's kind of how I got around to this patient-led cancer registry, is that I thought, how can I be a beacon of hope for others? Because I know how lonely it was. It's tough going through that whole process and understanding, you need to upskill yourself and all the medical stuff. So I really just decided that I'm going to live, and I'm going to do everything I can. And since then, I just decided, how can I support other people who go through this journey on a regular basis?
All right. So the message to people that get diagnosed is accept and decide to live, because you can, especially with the medicine that we have nowadays. Absolutely.
Mostly when people say cancer, you automatically think it's a death sentence, and it actually isn't. And I think we are very fortunate to be in the world that we live in today, where we have so many options. So 100%, there's definitely hope. And, don't think cancer, I'm going to die. Think, how am I going to beat this?
All right, so let's talk about the registry. What were you thinking you're going to do with it, and what does it do?
So, first of all, when I embarked on the journey, especially with my cancer, I realized there wasn't much information around angiosarcoma as such. And also the cancer registry at the time, it's quite a process to keep it updated. So I thought, how do we as patients get involved, and what could we do? And that's how I came about the patient-led registry. So we can decide, and we can support the government and help them gather the information. And really that's what it's about, is how do we gather data on the different types of cancer in South Africa, so that we can help the government, medical aides, and the medical fraternity decide what oncology medication and treatment to bring into the country. But we have to own it as patients. So that my goal is really to get a million registered patients and anyone living with cancer by the 4th of February 2022 onto the registry, so that we can do our little bit.
All right. So how does one get onto this? Let's say I've just finished with my doctor, my urologist, and I've just been told, Peter, I'm sorry, you've got prostate cancer. Do I start even at that point to register?
Yes, you can, absolutely. And anyone can register on your behalf as well. And it's quite simple. You just go onto our website. It's www.livingwithcancersa.co.za. And you click on the register button, and you register from there. It's pretty easy. We also run a support group through WhatsApp. And if you go onto the website and there's a button that says get in touch with us, you click on that, and we can easily get you onto our WhatsApp support group and stay connected that way. You can also contact me via my email, which is belinda@livingwithcancersa.co.za.
I suppose the thing now with a registry like this is that if somebody else gets diagnosed with angiosarcoma, they won't go through the same journey you did, that they can come onto the website. In registering, they'll be able to find resources of people who have gone through the same journey.
Absolutely. And on our website, we've got podcasts and we've got some stories. And what we're trying to do as a community is just be there and support each other. So you're absolutely correct. There's a lot more information. I had to tap into resources around the world in order to get information. I even had an operation in the UK. But there's a lot in South Africa that we can also do. And that's what I really like to do, is grow the South African base and support.
Are people coming to the party?
Mostly. I think we're still really new. We only recently just launched it. So we're trying to get out there, and we're just trying to get everyone to go through the process. Cancer is a interesting journey, because initially when you get diagnosed, you kind of hide away and you're just trying to get to terms with it. So I don't necessarily expect people straight away to be, seeing how they can give back when they're just trying to get through it themselves. So eventually you go through the journey, and then you want to help. So I'm also very aware of what people go through. But if we could support in any way, and if we could help you register, we're also happy to do that.
Yeah, and I guess data and information is a really big help.
Absolutely. It's literally going to make the difference in terms of what do we bring into the South African environment, and what do we need to do, because we don't have those stats available at the moment.
Belinda, we wish you the best of luck. Just give us that website address where people can register again.
Sure, it's www.livingwithcancersa.co.za.
All right, fantastic. Thank you so much indeed for joining us, and good luck with building this registry.
Thank you, Peter, and thank you for the support.
Great. That's Belinda Wagner talking about the first patient-led cancer registry. So you've got the address there. Please, if you know someone, if you're involved, then make sure that you register. Right, now, just want to say thank you to our guests for their participation, and our viewers for watching Health Talk. Don't forget, the only way to manage this pandemic is if we all play safe and protect each other. Stay at home, social distance, wash your hands and wear a mask. I'm Peter Ndora. Take care. See you next week.